Good morning, this is Dr. Vishal from Department of Conservative Dentistry and Endodontics from Malareddy Institute of Dental Sciences. Today I am going to take a lecture on tooth separation. Coming to the definition of tooth separation is process of separating the involved tooth slightly away from each other or bringing close to each other and or changing the spatial position in one or more dimensions. So coming to the reasons for tooth separation. The first and foremost reason is examination. In order to proper diagnosis of the caries, especially in case of caries which is involving only the proximal surfaces without involving the occlusion, the tooth separation plays an important role in proper diagnosis of the caries. And the next one is preparation of the tooth. In case of full coverage restorations for prosthesis, to prevent the iatrogenic damage of the adjacent tooth, tooth separation is necessary. And the next one is polishing of the restoration. After the completion of the restoration, in case of class 2 or class 3 cavities where the proximal surfaces are inadequately accessible to the polishing instruments, tooth separation play an important role for the proper polishing of those restorations. And the next one is matrix placement. In case of class 2 restorations or class 3 restorations, in order to place the matrix band, if there are tight contacts between the tooth, there will be difficulty in placing the matrix band. So if we separate the tooth from each other, there will be proper replacement of the matrix band which gives the proper anatomic form to the restoration. And the next one is for the removal of foreign bodies, especially in case of periodontal problems. If there is any food lodgement between the tooth, if we separate the tooth away from each other, there may be proper cleaning of the accumulated debris which leads to the proper debridement of that space. And next one is for the orthodontic purposes, that is repositioning of the shifted teeth. And coming to the methods of tooth separation, there are two methods of tooth separation. First one is slow method and second one is rapid method. Coming to the slow method of tooth separation, the teeth are slow and gradually shifted apart from each other. It takes more amount of time, from several days to weeks. Coming to the indications, it is mostly indicated for tooth which are tilted, drifted and rotated. That is mostly for the orthodontic purposes. For the tooth separation, this slow method of tooth separation is preferred. So coming to the advantages, tooth separation in the slow separation occurs without the damage to the periodontal ligament cells, so it is atraumatic. And coming to the disadvantages, so as it is slow in time, it is more time consuming and it takes several appointments, which is not comfortable to the clinician and the patient. And the next one is coming to the methods of achieving slow separation. The first one is separating rubber rings or bands, which is mostly used in the orthodontic corrections. And the next one is a rubber dam sheet. A thick rubber dam sheet can be used before the procedure to make the tooth separate apart away from each other. And next one is by using the ligature wire or copper wire between the two tooth which needs to be separated, and gutta percha sticks, or giving the oversized temporary crowns. After the preparation of the tooth, by giving the oversized temporary crowns, we can achieve the some amount of tooth separation. And fixed orthodontic appliances can also be given for the slow tooth separation. Coming to the rapid tooth separation, as the name indicates, it is rapid movement of tooth away from each other. Coming to the advantages, it is quicker and more predictable results compared to that of slow separation. But the major disadvantage is there will be traumatic injury to the periodontal ligament cells, because there will be rapid separation of the tooth which can cause the periodontal ligament injury. And coming to the principles of rapid separation, there are two principles which involves the rapid separation. That is, first one is traction principle, next one is wedge principle. Coming to the traction principle, this principle mainly uses the mechanical device which engages the proximal area of the tooth, and it attaches the proximal surface of the tooth, and after a certain activation there will be tooth separation. So mainly uses mechanical devices. And these devices which works on this principle are, first one is Ferrier double bow separator, and the next one is non-interfering tooth separator. So coming to the Ferrier double bow separator, as the name indicates bow, it is bow shaped, and this bow shape, there will be two bows which engages the proximal contact area of the tooth just gingival to the contact area, and a wrench system is used to turn the threaded bars. This helps in the causing of the separation of the tooth away from each other. So the main principle is wrench principle. There will be a wrench which will be unthreaded with the equipment provided, and there will be separation of the tooth. So coming to the advantages, stabilization of separation throughout the operation, and separation is achieved at the expense of contacting teeth rather than on one tooth. There will be two bows, so there will be multiple separation, and uses tooth preparation and finishing and polishing of class 3 gold restorations. So coming to the non-interfering tooth separator, it also works on the principle of same traction. It is similar to that of the Ferrier double bow instrument itself, but the only difference between Ferrier double bow and this non-interfering tooth separator is there will be no bows which will be interfering in case of placing the matrix bend, there will be non-interference of the bows. So this is known as non-interfering tooth separator. The advantage is separation can be increased or decreased after the stabilization, and as the name indicates, it is non-interfering in nature. So there will be no large bows, so there will be easy placement of matrix. So this is the difference between the Ferrier double bow and the non-interfering device. So coming to the wedge principle, after the traction, the next principle is wedge principle. A pointed wedge-shaped mechanical device is inserted beneath the contact area of the tooth, which in turn produces the separation. A wedge-shaped device is placed between the interdental region of the tooth to be separated, which causes the wedging principle and causes the separation of the tooth. So it is accomplished by two means: by using the device, that is Elliott separator, and the manual method like using the wedges. Coming to the Elliott separator, this is the picture depicting the Elliott separator, which is in the form of a crab claw. So it has a bow, two holding arms and tightening screws. Tooth separation should not be more than thickness of the periodontal ligament, that is 0.2 to 0.5 mm. So generally the thickness of the periodontal ligament is between 0.2 to 0.5 mm. We should not separate the tooth more than 0.2 to 0.5 mm because it can cause the damage to the periodontal ligament. And coming to the uses of this Elliott separator, examination and final polishing of the proximal restorations. It can be used for diagnostic purpose and also polishing of the final restoration. And coming to the wedges, these are the most commonly used equipment for the tooth separation as of now in the restorative procedures, and these devices are preferred for the rapid separation. Coming to the classification of the wedges, they are basically classified into two types, that is based on the material they are fabricated upon, they are classified into wooden wedges or plastic wedges, and these can be further classified as preformed wedges, that is these are commercially available wedges which can be preformed, or customized wedges. We can customize the wedges from the orange wood sticks or the oak wood. We can customize our wedges after obtaining the raw material. And coming to the next wedges, medicated wedges. These wedges contain certain amount of medicaments incorporated into it. Example like hemostatic wedges. It is mostly used for the hemostasis, that is control of blood flow, and also non-medicated wedges like orange wood stick, which can be used for fabricating custom made wedges, and synthetic wedges which are made by the synthetic resins. And coming to the natural wedges, example like orange wood or soft pine wood can be used for fabricating these wedges. Coming to the depending upon the shape, these wedges are classified into triangular or ovoid. Triangular wedges are also known as anatomic wedges because it resembles the interdental region. So they are also known as anatomic wedges or triangular wedges. And the next one is ovoid wedges or round wedges because they are round in cross section. Coming to the functions of the wedges, the most important function of the wedge is to closely adapt to the matrix band and prevent the gingival overhang or cervical flash of the material. The main aim of the tooth separation is to properly adapt the matrix band to the tooth such that the restorative material do not overflow into the embrasure region, causing the gingival overhang or cervical flash, and also it occupies the space designated to the gingival embrasure, preventing the restorative material from impinging onto it, thus assuming the proper health of the gingival interdental papilla. So it maintains the periodontal health. So helps in these wedges helps in rapid separation and establish atraumatic retraction of the rubber dam and the gingiva and assure the immobilization of the matrix band and also protect the interproximal gingiva from the unexpected trauma while preparing the tooth or due to the matrix band. And also whenever we are keeping the matrix band without the wedge, there may be chances of springing up of the matrix band due to the load. So if we place the wedge, there will be decreased chances of springing out of the matrix during the restorative procedure. And coming to the wooden wedges, these are the most commonly used wedges, and they absorb water and swell, thus stabilizing the matrix band and prevent the impingement of the restorative material. As they are wooden material, there may be absorbing of the excess amount of saliva or gingival clavicular fluid by the wooden wedges, thus stabilizing the matrix band, which gives the proper anatomy to the restoration. And these are available in two shapes as mentioned, triangular or anatomic wedges and round wedges, because they are circular in cross section. So triangular edges are generally indicated when there is deep gingival extension of the proximal box, which is anticipated, and because the greatest cross sectional dimension of the wedge is at its base. So in these cases triangular wedge is used. Whereas round toothpick wedge, they are placed in the gingival embrasure to protect the gingiva during the proximal boxing, and it is preferred with conservative proximal box preparation without the extension of occlusal surface. So plastic wedges, these are the wedges which are made up of the plastic. These are mostly advantageous when we are doing the composite restorations, because light can be transmitted through these wedges, so there will be proper polymerization of the composite resin. So in these cases, when we are using the composite resin as a restorative material, plastic wedges are most commonly preferred, and they can be even bent or molded to the configuration of the caul. Unlike wooden wedges, these can be molded to the configuration of the caul. So coming to the technique for the placement of the wedge, according to the Charbonneau and Phillips, wedge is most commonly placed from the lingual embrasure because of two reasons. Because lingual embrasure is the most widest embrasure, and also there will be no hindrance of the arm of the retainer while placing the wedges. And according to the Studvent, facial or lingual embrasure both can be used for placing the wedges. It depends upon the operator judgment. Whereas by Charbonneau and Phillips, the wedges should be only placed from the lingual embrasure. So coming to the length of the wedge, generally the customized wedges will be around 4 to 6 mm in length, and the wooden wedges should be approximately 5 to 6 mm long and should be trimmed for the proper taper, thickness and width. It should be trimmed according to the anatomy of the tooth. Coming to the next wedging systems, the first type of wedging system is piggyback wedging system. In this wedging system, a single wedge is placed first into the interdental region, and if there is any gingival recession or any periodontal issues, the wedges significantly will be placed apical to the gingival margin. So a second wedge is placed above the first wedge, that is piggybacked onto the first wedge to adequately matrix against to adapt the matrix bend to the tooth, especially in case of gingival recession or periodontal issues. So first a wedge is placed onto that, a second wedge is piggybacked onto it, and it is useful in patients with recession of interproximal tissue level or proximal box is shallow gingivally. So this is the first wedge, and the second wedge is piggybacked onto it. So coming to the next system, double wedging system, it is nothing but the use of two wedges simultaneously from the facial and lingual embrasure. It is most commonly used when there is wide proximal box. Two wedges helps to ensure that the gingival corners of a wide proximal box can be properly condensed, as well as to minimize the gingival excess. So the wedge is placed from the both gingival facial embrasure and the lingual embrasure. This is the double wedging technique. First one is piggyback and the next one is double wedging. Coming to the last technique, that is wedge wedging system. In this type of system, occasionally a concavity may be present on the proximal surface of the tooth, gingivally of the contact and extending as a fluting onto the root, especially in cases of maxillary premolars. There will be fluting or concavity of the tooth at that region. So after placing the wedge, a matrix band tight against such a margin, second pointed wedge can be inserted between the first wedge and the band vertically. This is the wedge wedging technique, to especially used in the tooth which have concavity or the fluting, that is maxillary first premolar. This concludes the techniques of the techniques of the different wedging systems and the tooth separation. Thank you.